Hi, welcome to the BariNation podcast, where we support the bariatric community with humor, humility, and honesty. I'm Jason.
I'm Natalie.
And if you're watching us today, we have one of the most amazing minds in the bariatric community, Miss Lora Grabow.
Hello, it's great to be here. Thank you.
Thank you for joining us.
I love to be here. It's great. It's been a while.
Yes. And April is not with us today, but I know we're going to have a very fruitful, engaging conversation. And today we're going to continue our theme for the season of spring, which is springing forward. How can we as bariatric patients spring forward in our journeys? Winter can be a difficult time for a lot of us, very emotional, very dark, physically dark outside. And so we wanted to bring some light in and say, we're here to help you, and we're here to share with you ways that you all can spring out of that winter brain. So today we're going to talk about emotional eating. What is it? Maybe we'll touch on also like why we do it. And then we'll kind of chat through why it's important for us as bariatric patients or those who have the disease of obesity to address this as part of our treatment. So I think we just dive in. Does that sound good?
Let's do it.
All right. So before we really get to the meat of the conversation, Lora, will you please introduce yourself?
Absolutely. So thank you for having me. My name is Lora Grabow, and I have been a bariatric therapist for 20 years, which is hard for me to believe, but it has been. It was 2003 when I started working with bariatric patients. And my passion as a therapist is to provide what I call is the missing piece, which is the third pillar of BariNation, which is mindset. What I have realized is the bariatric surgery population gets a lot of information on movement. They get a lot of information on nutrition. They get a lot of information on their tool of bariatric surgery, but not a lot of information on mindset. And that's where my passion is. It's providing the missing piece to the bariatric surgery plan. And I do that in several ways. I'm the owner of my own practice. And in these 20 years, I've obviously done the pre-op behavioral assessments that all of you have had to go through. I also do individual therapy and bariatric coaching, and I do that in person and virtually. Not sure if I mentioned I live in Michigan, but I live in Michigan. And so I have that practice. I am an expert in the BariNation membership community, which I absolutely love because I have such a passion to facilitate support groups and also teach topic groups, if you will. And I get to do that in the BariNation community. And then I also have created and launched my own online course called Foundations and Headwork for Healthy Weight Loss, because I wanted to get these headwork tools or mindset, I use the word interchangeably, out to more people. And then I do things like this. I do a lot of public speaking, not only for patients, but providers as well. So that's a little bit about me.
And Lora also is walking every single day.
Oh, yeah. Yes, that did not start out as like I don't believe in New Year's resolutions. In January, I was like, I think I'm going to try to walk every day in January. And what helped is I made it a very realistic goal. I tried to practice what I preach. I was like, you know what? I only have to walk 15 minutes, which is about around my block. I can do more if I want, and I do. So I have now walked every day. I will walk after this podcast, which will be day 108. So yeah.
Absolutely incredible.
Yeah, it's been great. It's been great.
Awesome. Well, thank you for being here again. We are so ecstatic. We love you as a working professional relationship, but you are also a very dear friend to us. And so we're excited to dive into this a little bit more.
Yes.
So I think we just start, pretty high level and just define emotional eating.
Yes. So emotional eating is really eating when you're not physically hungry. That's it. Anytime we eat and it's not out of physical hunger, it falls under the umbrella of emotional eating. Mm-hmm. That's it. And
Which we
then,
talked a little bit about this before we started recording, and that even blew my mind because I had no idea. I just figured, assuming it was all attached to emotions and how you feel, and if you felt bad, you ate something. If you felt good, you ate something. Like, I had no idea that it was just any time you weren't physically hungry, because we talked about the compulsion of if you just have something sitting out. So if somebody brings something by the office, or somebody brings something to your house, and it's out on the counter, and you just walk by and grab one because instinctually that's just what we do, what we've always done. I had no idea that was also linked to emotional eating. So that was crazy for me to even hear.
yeah, absolutely. And I'm like you, Jason. I always believe I have something to learn. And when I first started working in the field, I only taught on physical hunger and craving, right? So that's what people understand. They understand that physical hunger is, oh, I know, I'll just keep talking. There we go. Physical hunger is physical hunger. That's actually something your surgical tool helps you with, right? Our patients say for the first time, they understand what being physically hungry means and physically satisfied. And then I would teach about craving, like you're craving one food. And that's how I would describe emotional hunger. Well, I'm always learning, right? And I listen to my patients' stories and I'm like, there's something in between there. Like there's physical hunger and there's also emotional hunger, eating, when we're feeling happy or feeling sad. But sometimes you just eat because it's there. What's that all about? And I learned that's actually called eating out of desire. You're not particularly hungry, but you eat because it's there. You walk by your colleague's desk and they have, a bowl of M&Ms. You walk into the break room and there's a donut. You weren't thinking about donuts. You have a 9x13 pan of brownies on your kitchen counter. You're not particularly hungry, but you see them and you grab a little bit. We call that eating out of desire, but it still falls under the umbrella of emotional eating. So emotional eating can include eating out of desire and then eating to cope with our feelings.
And you've said something on previous podcasts, which we will also link in the description here. You said something a while back too about how if it is a sense, so the 5 senses, like that looks good or that sounds good, that is also falling under the realm. And as you both were talking, it's like you walk by that tray of brownies and you're like, oh, that looks good. Like that's the thought that goes through my head.
Mm-hmm.
So I just connected the two and saying, oh, of course that's emotional hunger because, it looks good. It's not like I'm hungry, I'm starving and I want to eat that brownie.
Right. Absolutely. I'm so glad you brought it because I love that we're, just starting with basics. And I often teach. So another, we'll be using words interchangeably, but patients also call emotional eating head hunger, right? My patients will say, I've had surgery on my stomach, not my head, right? So that we're talking about the same thing. And so many times patients ask me, how do I tell the difference? How do I know when I'm emotionally hungry or head hunger versus physical? And that's what you're referencing, Nat. You're referencing when I teach on, physical hunger has more physical symptoms, maybe not right after surgery, but your stomach may growl, it may not growl. You may have a feeling of emptiness. You may be dizzy. You may be lightheaded. You may have more behavioral symptoms, meaning you're irritable and crabby. Some people call that hangry. Okay. A really good warning sign, if you will, on how to recognize emotional hunger if it is tied to your senses and you hear where you don't have physical symptoms or behavioral symptoms, but they're more thoughts. Mm-hmm. If that looks good, those brownies look so good. Pizza sounds so good. Oh, that popcorn smells so good. After dinner, you know what? I have a taste for something sweet. If you're hearing thoughts like that in your head, that is really good warning sign, like, oh, this is emotional hunger, not physical.
Mm-hmm. Yeah, that blew my mind. I have always referenced that since we had that conversation because it is such a, well, I won't say it's foolproof because nothing in this world is foolproof, but it's a fairly foolproof way to check yourself when you catch those thoughts, yes, even after the fact.
Yeah. And I'm so proud of you, Nat, that you can catch the thoughts.
I wonder how that happened. Maybe it was by attending BariNation support groups weekly. Which I am so thankful for, and so many are also thankful for. So but it works. If you guys attend things, it does work. So how or what steps can we take as bariatric patients, as those treating our disease of obesity? How can we, what steps can we take to move forward or start kind of tackling the mountain that feels like emotional eating?
Mm-hmm. So emotional eating is a mountain. It's a lot to jump into. And again, I don't think enough surgical patients are getting resources on how to work on their emotional relationship food in their surgical binder. And I'm so glad we have a community like BariNation that does this podcast, and a membership community where we have support groups to address this. And there's really different parts, if you will. And so the first is we've already addressed, am I an emotional eater? Well, how do I know that? Well, what's the difference, right? Like, what's the difference between physical hunger and emotional hunger? For example, when I would do the pre-op behavioral assessments, I would say, do you struggle with emotional eating? And the patient was often like, no. And I'd say, well, do you eat when you're bored? Yes. Okay, well, that's emotional eating, right? It just needed some education. So first it's understanding what it is, what's the difference, and then it is understanding why you emotionally eat, which we may get into, we may not today. That's I call it diving a little bit deeper. And then it is, you got to figure out what are your thoughts and feelings that are triggering your emotional eating. And then you have to figure out, how do I honor those thoughts and feelings? What are the needs in non-food ways? And that is quite the process. And you've probably just figured out it's easier to emotionally eat than do all that stuff.
Absolutely. Well, I know that I wasn't honest with myself before I had surgery, because I swore up and down I wasn't addicted to food. I didn't emotionally eat. I just had a problem with the quantity of food that I ate. That was it, the end. And if you guys could fix that, then I'd be cool on the other side. I just won't worry about anything. Well, then the more it unraveled after I had surgery, I realized, because I went through a big bout of all of that, of the head hunger, the emotional eating, all the things that I wanted to do, but couldn't physically do. So after I had my little period of where I was like super locked in, dialed in, was just going to do it all right, when everything started kind of coming back, the ghrelin started kind of reappearing, like everything started kind of going back to normal, I realized that I hadn't dealt with any of that. So there I was again, not being able to eat all the things that I could before, but still wanting to, or wanting to try, or thinking that I could try, and realizing that not only wasn't going to benefit me in what I wanted for myself, but it was a bigger problem than I even let myself believe. Because we can talk ourselves into or out of anything. I always say that. But I legit had myself convinced that I didn't have a problem. There was no problem here, except for the amount of stuff that I ate. And if I just didn't have to eat that much, it'd be great. So I think, I know I'm not alone in the fact that I've convinced myself, because I'm sure others have too. But it's the revelation of finding out those things without assistance is way harder than if you have somebody there to kind of help you along and figure out kind of how to unpack those boxes. And that's why you've been so instrumental, not only myself and Natalie's situations, but a lot of other people who, have dealt with you and had you to help them along in their journey.
Right. And I want to say to you, Jason, you can say you're in denial, but also, how do you know what you don't know? When it comes to weight loss, losing weight and keeping it off, the only thing you ever had been taught was eat less and move more.
Yes. Yeah,
right.
Diet and exercise is going to fix it all.
So of course you answered it, well, I just have to eat less. But nobody told you you have to work on your emotional relationship with food if you also want to lose weight and keep it off.
Oh yeah, no, that was never anything. The emotional, the mental, any aspect of after my check cleared was not discussed with me pre-op. I went through, I faked my way through the little, psychological exam, and then went in there and poked all the boxes that I needed to on the MMPI that they gave me. That was kind of like, all right, man, this is cool. I guess I'll see you when it's time for surgery. And it wasn't even something that I took seriously at the time, because I just had no idea that it was going to be such a monumental thing post-op. And I mean, part of me kind of says I get why they don't tell people that ahead of time, because you'll scare half of the people that were going to have surgery off if you tell them all the things wait for them on the other side. But I just honestly feel like it's something that's so undersold when it comes to this procedure, because most people think just like I did. Oh, I just get my stomach cut out and then everything will be fine. Like, I don't have to worry about anything on the back end because I'll be slim, trim, and I see everybody's after pictures, and that's what I'm going for. So let's get that after picture. Woo, let's go. And they don't think about any of that.
Right. Right.
So you mentioned before, Lora, that like really the first step is identifying that you are an emotional eater. And how does one, let's say I am, pre-op, or I just had my surgery and I am 6 months out and I'm starting to notice, habits creeping in, and I'm scared and I don't realize, or I don't really know what's going on. All I know is that I'm eating popcorn by the bag full, and the scale isn't moving. How can I, what are some questions that I or someone else could ask myself or ourselves to get to that realization?
I think a really powerful question to ask pre-op and post-op, if you didn't ask it pre-op, is what role does food play in your life? Or sometimes I ask it, tell me about your relationship with food. And so I ask you, Natalie, and Jason, we'll start with you, Natalie, what role did food play in your life?
Yeah, it was comfort. It was, I think comfort is the key for me. It was there when I was bored. It was there when I was anxious and sad. It was there when I was happy. It was just that comforting friend that was always linked to me.
Oh, there's a word. You had a relationship with food, right? It wasn't, you didn't answer fuel, right?
Nope.
So how do you, and you're not alone. We all have an emotional relationship with food. But here's the thing. Here's how you're like friend, right? Food was my friend. Food comforted me. Food was always there for me. I could count on it. Food took care of me when I was anxious. So it sounds like food was a way you would soothe when you were upset.
Yeah.
So you go back and be like, did that have anything to do with physical hunger? No. Right. So that helps you, right? Like, what role does food play in your life? What type of relationship do you have with food? And I hear often exactly what you shared. Now, I don't know if Jason, if you want to share what role food played in your life pre-bariatric surgery, and maybe even now, post.
I will say pre-op food is legitimately the only thing that never let me down. I would let myself down. I let friends down. People let me down. But food, like Nat said, was always there. Like, you could always go see the smiling face in the drive-through window. You give your mother, the light was always on. They were always willing, ready to hand that bag out the window, and all you had to do was give them a little money and call it good. And whatever was happening at the time, happy, sad, angry, mad, whatever that may look like, depressed, whatever, that bag was there to comfort me and get me through to the other side. And it never let me down in the moment of what I needed when it was time. So whether it was celebratory because everybody, so everybody had a good day, we go out and celebrate, that's what you do. Birthdays, weddings, all the things you do, that's the biggest thing. And on my mind, pre-op was always about, no matter what the event was, no matter what happened, there was two things I needed to know: what the menu looked like and where was a place I could sit down and be comfortable. Those were the only two questions. You could tell me we were going anywhere in the world at any point in time, and I would ask you those two questions: what are we eating and where can I sit? And that was it.
Right.
Because it literally controlled that much of my life. That was all I was worried about, was if there was going to be enough for me to eat, and if there was a comfortable place I could sit down, because I know I couldn't stand long enough.
It's interesting you just use that word control, because that's what I was going to bring up. So I hear you say, you know, food was always there for me. I could count on food. I could always predict the outcome with food. It would always give me pleasure. I could count on that. That experience never changed. And what I've learned, not only, you know, from my expertise as a therapist, but also what I learned from my patients, and that's where I learned the most from, is emotional eating really isn't about food. If you struggled with disordered eating, so emotional eating could be part of disordered eating. Disordered eating also can be, is disordered eating. There's also could be an eating disorder. That's a whole nother podcast. But they're not about food. They're about control. And what do I mean by that? So many of my patients describe their emotional eating exactly like you, Jason. It's something I could count on. It's something that was constant. It's something that didn't change. And life is hard. Life is stressful. If anything taught us we're not in control, it was going through a global pandemic and what we've been going through the last 3 years. And what I hear from my patients, and again, I don't think they can identify it, right, without us kind of unpacking it like we're doing right here and you're with a bariatric therapist, is there's all these areas out of my control, Lora, but at least at the end of the night, I got my ice cream. Okay. Yeah. There's all these areas out of my control right now, but at least the light's on at Krispy Kreme, and I know they're going to give me a donut with a smile, or I know I'm going to get the bag through the drive-through, and that feels good. And I can count on it. I can't control all this other stuff going on, a global pandemic, work stress, job change, family stress, unexpected loss. But you know what? I can count on that ice cream. And what my patients then say back to me when I teach on this and talk to them about it, they'll say, but I'm out of control. Like, but I'm emotionally eating and I'm out of control. What do you mean? What do you mean I'm seeking control in emotional eating? I said, well, you may feel like you're out of control, but you get to be in control of being out of control. I'm going to say that again. You get to be in control of being out of control. And another way of saying that is nobody can make me stop eating.
Nope. You choose when you start, you choose when you stop.
And that brings an incredible sense of power. And that's why we know I mentioned eating disorders. Not all emotional eating is an eating disorder, but emotional eating disorders aren't about food. They're about control. Mm-hmm. And those that are restricting, nobody can make me stop. Nobody can make me eat. And it brings you a sense of power and control where you don't feel power and control in other areas of your life. So you take it with food, restricting food. Or my population, my favorite patients that I work with who struggle with binge eating disorder in the field of obesity, it's no one can make me stop eating.
Yeah. Mm-hmm. And well, I mean, it's funny that I couldn't pinpoint it before I had surgery, but once the fog of everything cleared and I got a little more level-headed about what was going on, I can pinpoint the time that it happened. I know why. I've done the research, I've done the digging, I can unpack all of that as to why. Mm-hmm. And it's funny to me because that's at 9 years old is when I started those things. Like my mom, I was born in, I'm an old man, so I was a latchkey kid back in the day. So my mom would fill the house full of stuff and then just go to work and be there, and I'd be home. And I could eat a family-sized bag of chips and a 3-liter of Coke at the time, and nobody could tell me that I couldn't or could. And, you know, I've told this story before. My father left when I was 9, and there was nothing I could do to stop that. Nothing. I tried everything in the world. Cried, hung on his leg, walking out the door, did everything I could possibly try to get him to stop, and I couldn't. So knowing that moving forward, that was my control. I could do, there were certain things that I knew I could control, and that was one of those things. And there was nobody to even watch over me to tell me that I could or couldn't do it because my mom had to go to work. So my mom was working and just me and my brother sitting around the house all summer long. Granted, back then we rode our bikes, 50 miles a day. So there was lots of exercise involved. However, every chance I got to sit down and plow through whatever food I wanted, I had the ability to do that because that was the control that I had.
Right. And I also hear in that, Jason, besides control, so you're hungering after control, So a big part of emotional eating is, what am I really hungering after if it's not food? You are also hungering for connection.
Mhm.
And that's healthy, right? When we're okay, so if we name the feeling, I may be jumping ahead, Nat, you can bring me back if I am, but you
Nope.
know, once you identify you're an emotional eater, you also have to work on, okay, well, I have to name some of these feelings. And so if the feeling's loneliness, it's normal and healthy that you are hungering for connection. Well, I think that answered the question when Jason, you said food's always there for me. So by default, how did you get that connection? It was food, and it worked for you, right? And at 9, that's all you had. But now you're not 9. Now you are a bariatric surgery patient. Now you do have other resources around you to say, using food as my emotional connection, it really is not working for me anymore. Are there healthier ways to do that?
Mhm.
Right.
Yeah. And it took, there's been a lot of repair. There's been a lot of talks, a lot of things done. So that, I don't live in the 9-year-old space anymore all the time. I'm not going to say I don't ever go back and visit from time to time, because, we all do. That's how that works. But it's definitely something that there was a lot of power in breaking that down for myself, coming to that realization and kind of knowing the genesis of all that, and what was behind it and what driving that force really did give me a lot of power to kind of take a different type of control, if you will, and control myself for the better into where I am now, which is way better than I was before I had surgery. So
Isn't that something? That makes me happy that you're doing the work. You're doing the work of weight loss surgery.
I had to.
This is the work, right? Like, this is, we said it at the top, that the nutrition, the movement is so important. Those are 2 of our pillars, movement and metabolic wellness. But you need that mindset piece.
You absolutely need the mindset piece. And I want to ask you, Natalie and Jason, if you ever experience this. I hear it often in the BariNation groups come up, especially in our newer surgery patients, like they've just had their surgery and they report feeling, I thought I would feel so happy, but I'm angry. This is hard. I'm weary. I thought I wouldn't be thinking about food, and I am thinking about food. I got to think about it in a different way. And if I talk to your loved ones, maybe, because a lot of my work in my 20 years has been educating support people, and they're like, wow, she's feeling or feels like, I didn't know she could be that upset, or what in the world is going on? I'm seeing some anxiety that I never saw before. Can you identify with any of what I just described?
1,000%. I tell this often. I lead a pre-op and beginner bariatrics meetup every week in the bariatric or BariNation community. And I tell this story very often because it is one of the, I think, my pinnacle moments of realizing that food wasn't so emotional for me. And it was actually during my pre-op process. It was within those 2 weeks leading up to surgery where I was allowed 1 protein shake a day and the rest was clear liquids. And my dad made ribs for dinner one night. And now I'm not a red meat girl, never really have been. Ribs are not my first choice in meal. But I got so angry at him. How dare you make ribs? You know that I can't eat right now. And my eyes welled up with tears. I was so mad and frustrated. At the time, I was putting it on him. But it was really because I realized the precipice of what I was about to do, as a lot of patients go through a similar realization. But it was that moment, as well as the 2 weeks post-op when I was home and my dad would watch MasterChef or a cooking show or something. And it was the same feeling of just like like putting that blame on him of like, you, like, why are you cooking, or why are you watching this show? And just that anger. And I'm so not an angry person.
On a scale of 1 to 10, how would you rate the level of that anger? 10, highest disturbance imaginable, and 1, like, yeah, I wasn't really that mad.
Oh, I was at least a 9, if not a 10.
Yeah. So you're not alone. And this is what I hear from patients. They're like, why on earth am I feeling my feels at a 9? Because I'm not a 9 person. Here's the thing. Before you had bariatric surgery, how did you feel your feelings?
I
Like,
didn't.
right. What did you do instead?
I ate food.
You ate food. So what I've learned from my patients is on a scale of 1 to 10, especially if it was an uncomfortable emotion, right? And there's no such thing as positive and negative emotions, good or bad. They're either comfortable or uncomfortable, pleasant or unpleasant. But especially the uncomfortable ones, maybe they let themselves feel it to like a 3 on my 1 to 10 scale, and then they ate to take the edge off. Then they ate to stuff it down, to numb it, to avoid. Well, guess what? You can't do that after bariatric surgery anymore. So all of a sudden your feels are at like no longer staying at a 3.
Yeah.
Okay. And that's what you were experiencing with your dad. And we can't talk about basic emotional eating and keeping it at a high level without understanding first of all, one, everybody is an emotional eater, not just those that struggle with the disease of obesity and have bariatric surgery. Everybody emotionally eats. However, what we know about our patient population is our patients have difficulty naming and feeling their feelings without food. The fancy words we call that are self-soothing, affect regulation. These are like the therapy words, but our patients, for whatever reason, we're not given the best messages about feeling their feelings. They weren't taught how to name their feelings, and they certainly weren't taught how to process their feelings. And I'll be honest, I even think as therapists, or really any of us working in obesity medicine, we can say, well, you got to learn to, just process your feelings without food. Well, we say that, but we don't teach you how. You're like, what does that mean? I don't know.
But I think this is where the power of, last week we talked about peer support with Sarah Smith, another one of our BariNation experts. This is the work, right? Like going to a bariatric therapist like Lora, or going to support groups that are targeted for emotional eating, really does give you those tools, even if you don't have anything to say at that day. Just by attending and going is immeasurable. Especially like I've been going since last August now, almost a year, which is crazy. I've been going consistently.
And that is the emotional eating group in the BariNation community, right?
Yes, it is. And we use it every week, and now we have 2 a week of just emotional eating support. The things that I have learned alongside my peers is incredible. And now, we were on vacation in Houston, right, Jason? And we'd call each other out. We'd say, oh, that, what would Lora say? Or like, Laura, we would say, well, what would Lora say? Or I can hear Lora being so proud of us right now.
Yes, that's what I like.
Well, we need both, we need a little bit of a check, and then we need to pat ourselves on the back. But it's going to these things consistently in the BariNation community that have taught me, oh, I am craving connection. Maybe I should do that instead of eating the cake that I bought. Or maybe I should clean my house instead of sitting on the couch and eating because I'm stressed about how dirty my house is. And those are the tools that you can gain by working through this emotional eating and this head work.
Well, because we've learned adjunct treatments are necessary because we like our recent podcast we had not too long ago, surgery is not enough. You can't just go through the surgery and expect to be all better without some adjunct treatment. And communities like BariNation and, GLP-1 medications and some of the other things that we found are all adjunct treatments, but people don't think about community, like Laura likes to say, community is treatment. Like that's so true that we can't say it enough. Because having the community, having communities like BariNation, having classes like Laura's in BariNation they're so key to the success of so many people in getting them back on track and getting them to where they want to be. It's just, it's one of those things we wish we could shout from the rooftops and let everybody know, because it doesn't have to be that hard. Like it's going to be, the work of weight loss surgery is hard, but it's a lot harder when you're trying to figure it out on your own.
Right. Yeah.
I guess as we attempt to start to wrap up, these conversations always go, because this is a huge topic and this is something that we're really passionate about. But if you could encourage, and I'll ask you, Laura, first, and then Jason, myself, but what is something that you would tell a patient who is just starting, or what would you tell someone who thinks they have emotional eating, which we've established everyone does. How would you encourage them to work through this? Because this is a mountain, and we are talking really high level here. There's a lot more to dig into. How would you encourage someone to just start?
That's a great question. So the first one is just slow down. So what do I mean by that? If I can just get you to slow down before you put anything into your mouth. I know that eating feels automatic, but it's not. It's not. Our heart beating is automatic. We didn't have to wake up today and tell our heart to beat. Thank goodness, right? But every time we put something in our mouth, the thought comes first. And if you don't believe me, if eating was automatic like our heart beating, you would not only eat the cookies, you'd eat the plate that the cookies are on. Okay? There's always the thought that comes first. So the first thing I want to get you is to slow down and ask yourself, go back to what we talked about at the beginning of the podcast. Am I really physically hungry? What's going on right now? What am I hungering after? If you are not physically hungry, get out of the kitchen, remove yourself from the environment. Okay. That's your first basic high level step, if you will. Then I would like you to work on. So the next thing I would say, and I've learned from experience is, well, then go process what you're feeling. But what I've learned is my patients don't have a feeling vocabulary. So talk about basic, right? You have to have words to be able to name your emotion, right? And so learning that there's more than happy, sad, mad. By the way, the number one feeling all of us emotionally eat for is happiness. We like to keep the good feeling going, and we do that well with food. So work on establishing a feeling vocabulary. So take some time. You're all working hard on tracking your food. Could you also do a mood journal? Could you just every day write down 2 feelings that you're feeling? There's feelings lists that can help with this. There's apps that can help with this. How am I feeling? Okay, get the feeling words. Then, right, okay, so slowing down, am I physically hungry? If I'm not physically hungry, naming the feeling, having a feeling list. And then it's like, okay, my feelings are almost warning signs. And I don't know if I'd use warning, because warning sounds like we're in danger. I think I would say it's giving you data. It's signposting that you need something. So what do I really need? And that's what we're talking about Jason, he needed connection. And then the final thing is, if I need connection, what's a non-food way I can do that? And that would be, going to a group, calling someone, right? That sort of thing. So slow down, create a feeling vocabulary, identify the feeling. What is your feeling telling you? How do I meet that feeling in a non-food way?
I love it. Jason, what about you? What would you say?
I would say don't be so hard on yourself in feeling like you're the only one out there that this is happening to. That if you just would have made a better decision, or if you just were a better person, or if you just were stronger, you could get past this and it wouldn't be affecting you in this way. Because a lot of people will carry, things that don't belong to them. You just carry all this weight around of these heavy burdens that you don't need to carry because it's not your fault. You didn't do this to yourself. It is not something that you just decided one day to go, oh, that's what it's going to be. I'm just going to eat everything I see. Whatever I feel like doing, I'm just going to cram it in there. Like, that's not how this works. So, making sure that when you talk to, because, like I always say, the loudest voice you'll hear all day is the one that's inside your head. So make sure that it says kind things to you, because you're not going to do yourself any favors if you continue to be down on yourself and browbeat yourself about not being able to get past this on your own, because that's only going to drive you further into an emotional eating episode, or has the high likelihood to do so. So if you approach it in a way of saying, you may say, I didn't even know this happened to me. I can't believe I'm in this position. Those are things that are kind of neutral in the way to say, without, to admit what's going on without placing the blame on yourself. You can say, wow, I didn't think this was how this was, and I can't believe I'm here. But the fact is you admitted you're here. Mm-hmm. So the next step is figuring out how to get out of here and get to a better place. And the journey of 1,000 steps starts with one. So take the first step and do it.
Love it. How about you, Nat?
Very similar to both of yours, but I think really just telling yourself that it'll all be okay and it'll all work out. When I realized that I needed to change something around this time last year, support, attending classes, the domain that we have created, I didn't think that it was going to be that vital. However, as soon as I took that first step, like Jason said, I realized just how monumental emotional eating was and how much it affected my day-to-day, hour-to-hour, minute-to-minute life. And so first piece of advice would just be to start. Just pick something and start. But my second piece of advice is that you just have to keep going. And it gets really exhausting and tiring to have to call yourself out all the time in the nicest way possible. But calling yourself out and saying, hey, you're not eating for nourishment, you're eating because XYZ, it's exhausting. And Lora says this a lot in our group, that it's a lot easier in the moment to eat than it is to work through why I'm eating. But it does come clear eventually, and in time, and with consistency in working through that emotional eating. And so I know there are a lot of people, our emotional eating support groups are the highest attended groups for a reason. And Lora always says this every week. Everyone struggles with this, but I have worked alongside so many of my peers, and we are doing it together because it's possible, but we're all tired sometimes. It's hard work, it's daunting, but you just have to keep going. So.
Well said.
Amazing. This was a great conversation. I know we did not get into the nitty-gritty, but I know there are a lot of folks that are just joining us. There are a lot of people who maybe have not heard anything about emotional eating. So I'm really glad that we could sit down today and just have this conversation. If this conversation has sparked something in your brain as you're listening, maybe you think, maybe I have emotional eating. Maybe I need to work through some things. We do have the BariNation community. We have 4, like Lora said, 4 weekly support groups led by her specifically.
Many more.
So many more.
So many more, but I do 4 in the community.
Yes, and we are onboarding new therapists every like all the time. We're having so many conversations so that we can have these powerful conversations every single day. And it's constantly growing. So if this is something that as you're listening, you're thinking, maybe I need to move forward and work through some of this, we have that community for you. You can go to barination.mn.co. The link will also be in our description. But if you go to that link and sign up, it is $39 a month after a 2-week free trial. So you can try us out for 14 days, see what you think, poke around, get the support that you need. And then you'll be on hopefully for the duration of your bariatric journey, which is a lifetime. So
yes.
Well, there's over 100 live supports a month. So, I mean, it's not like you just get in there and just do the 4 classes for Lora. There's classes, there's multiple classes every single day. We're working on getting more supports on the weekend. I lead one support group on the weekends now. We're trying to add more in there. So it's going to be, it's something, there's something there for everybody, regardless of your age, your stage. Everything there that, is led with you in mind, built by not only us who are patients, but also other patients. We've beta tested this thing for a year and regularly build in supports asked for by the community as time goes. So this isn't just something that we put together, just decided that, April, Natalie, and myself, we're just going to put out what we thought everybody needed. This is legitimately built by experts in the community as well as the community itself. And
we have 3 different types of support. We have classes that are led by professionals like Jeannie is a dietitian, Kayla. They teach about nutrition and hold regular classes. We have support groups, which are led by therapists, bariatric therapists, addiction therapists, and those are support groups. And then we have meetups that are led by peers, such as Jason and myself. We're not professionals as far as mental health and the medical side of things, but we are professionals in our bariatric experience. And we're not the only peers that lead groups. We have so many others to offer weekly, but it's a pretty rad place to be. We're pretty proud of it.
It absolutely is. And yes, you may not be professionals, but patients are the experts. You're the experts. You are the experts on the bariatric journey. And as a provider in bariatric medicine, obesity medicine for 20 years now, I can't believe the access to professional and expert support you can get for $1.40 a day at BariNation. It's unheard of. I've been doing this for 20 years. You are worth it. You took that first step when you said, I'm going to have bariatric surgery. I want to improve my life at all levels. You are certainly worth continuing to live that out by committing to the BariNation community and getting your lifetime treatment for the chronic disease of obesity.
Absolutely. Lora, would you like to leave us with any more wisdom or anything else you'd like to let our listeners know?
Yeah, couple things. One, I just always love being on a podcast. Some of you may have heard me before, but I'm sure I'm new to many of you. So I do have a website. You can pop on over to loragrabow.com, which I'm sure will be linked. Please join my email list. If you want to dive deeper, we took things really high level here. I offer a course I mentioned at the beginning. It's Foundations and Headwork for Healthy Weight Loss, where I teach these foundational skills you're not getting in your surgery binders. So I do 2 full sessions on exiting your emotional eating roller coaster, but we also address topics like squashing your stinking thinking. Could your yes be sabotaging your bariatric journey? And also building and using your support team on your bariatric journey. So I would love to invite you into my online course community. And if there's one little nugget I could leave you with in light of this topic, it's something I often say in the emotional eating support groups, and that is your feelings are worth more than French fries.
Amazing. We love that.
They
That's
are.
My
popular
favorite.
perfectionism. Awesome. Well, Jason, do you want to take us out?
Yes, ma'am. Laura, thank you for joining us. Your time, your knowledge, your wisdom is always appreciated. We thank you so much for always making yourself available to us. We cherish every minute we get to spend with you, and your knowledge to the community is invaluable. So thank you very much. We want to thank the community, because without you guys, we wouldn't be here. The likes, the shares, the subscribes, you guys tell friends that we're here, and that's amazing, because our community needs to know that there is help out there. So we can't thank you guys enough for doing that. Don't forget that you can also leave us ratings and reviews on your favorite podcast player, as well as our YouTube channel. If you have what was formerly the Anchor app, which is now the podcast player specifically for Spotify, you can still leave us voice messages that we can incorporate into future episodes of the podcast, because that's just another way we get to shout you guys out. And we love sharing our community stories and voices. So thank you guys for that. And just remember, at the end of the day, you've got this, we've got you, and we'll see you next time.
All right. See you guys later.
Bye, everybody.
Bye.